Hi, my name's Amanda. I'm a student pharmacist. How are you doing today?
I'm doing well, thank you. How are you?
I'm doing good, thanks. Looks like you're picking up a new device today, is that right?
Yes.
Alright, I just wanted to take about 10 minutes of your time, go through the device, how to use it, and what to expect. Is this okay with you?
Yeah, sounds good.
Okay, great. Can I verify your full name and date of birth?
Yes, my name is Ashley Pugh and my date of birth is 11/26/1995.
Great, thank you, Ashley. So your doctor prescribed you the True Metrics glucose meter, and we're going to go through everything that comes with this kit, okay? What did your doctor tell you what this was for?
He just said it should help with my diabetes.
Yeah, so it's actually going to allow you to measure your own blood sugar levels at home, okay?
Okay.
And how did your doctor tell you to take this or use it?
He didn't really give me much direction at all.
Okay, that's totally okay. We're going to go through all of that.
Okay.
So first thing that you should know is that you're going to be taking or using it and measuring your blood sugar every morning. Usually when you wake up before you eat anything. Okay, and that's called your fasting blood glucose. And your prescriber gave you one of these kits, and that includes the meter itself, and then he also gave you a prescription for 100 test strips, and those test strips have 3 refills. Okay. All right, so we'll just go ahead and get into the meter itself. So when you get the box, you're going to open it up and you'll get this bag. And in the bag, it's a nice little travel kit. You'll get the thing of test strips here. The good thing, or the important thing about the test strips is that you're going to check the side of the vial here and find the expiration date. The expiration date is whatever's on here, or it's 4 months from whenever you open it. Okay? And so just whatever comes first, and just make sure it's not expired. You'll also get this lancing device, and this is what you're going to use to prick your finger with. And you've got the glucose meter itself. And then you also get these blue things, and they're called lancets, and these are the actual needles to use to prick your finger. So that's about it, what comes in the bag. So we went over the expiration date for this, and so now we want to just make sure that everything's in order for you to get started with testing your blood sugar. So with the lancing device, first you want to wash your hands with soap and water, and you'll just pick up your lancing device and open it up by separating it at this crease here. So you can just set this the top aside, and then you're going to grab one of your lancets. So these do have a needle in them, so be very careful when you're handling them. So you're going to find that little groove on there, and then place it in there very carefully. So this is the top here. You're gonna want to twist the top off very, very gently, so that you don't bend the needle, and then just keep twisting until you think that it's fully separated, and then you pull straight off like that. And then go ahead and keep this on the table next to you, because you're going to use that for safe disposal of the needle later. So once you get the lancet in there, you're going to put the cap back on, and then line up with the button there, okay? The next thing you need to know about are these numbers on here. So they range from 1 to 5, you can just see here, and this is going to actually, this is a measurement of the depth of the needle prick. So what we usually recommend is to start with 1, and then if you're not getting enough blood for the measurement, just go ahead and switch it up to 2, and then so on until you get a good amount of depth, whatever's comfortable for you. And so we'll just go ahead and start off with 1 today. So I'll set this aside until we are ready to actually prick our finger. So next we want to get our meter set up correctly. So you'll grab one of your test strips, and then go ahead and make sure to close this after grabbing it. That way nothing gets in there, no moisture, and your test strips stay safe and effective. So next you're going to insert your test strip into the glucose meter. The good way to remember which way is up is I look at the big black square. So that's actually going to go into your device. And then the well at the end is what's going to collect your blood. So that's going to be facing up and coming towards you, okay? So now that it's in, it's going to actually turn on automatically. So we see that it's ready to go. So with this, you're going to pull the plunger back, and then you'll kind of feel a click, and the button comes out, and then you'll be ready to actually puncture yourself. We'll go through wherever the puncture sites in a little bit, but once you actually puncture yourself, then you'll get the drop of blood on your finger, and the blood will come out, and you'll just keep squeezing until you get a good enough drop on there, and then you'll bring the test strip up directly to your finger and allow the blood to just go right into that well. It's pretty easy as long as you just touch the blood to the test strip. It goes right in there. So you don't have to drop it down. Don't try to like put it on any other spot other than the actual well itself. And then once the blood is in there, the meter will read the blood glucose level, and it'll be able to actually store that in your device. So this will come in handy whenever you're going to doctor's visits, so that your doctor can actually see exactly what your readings were at. Once you're done, you'll just go ahead and hit this button, easy, and pull it out. And then that actually automatically turns off the meter itself. And this can go straight in the trash. Okay, so let's talk about sites. So we normally, we really recommend just using your fingertips, but it's not the whole finger pad or anything, so we actually recommend the sides of your fingertips, and that's just because it's less pain, and you'll get enough blood from the sides of your fingertips too. So what you'll do is just put your hands together, and then whatever sides that you can see with your eyes, that's a good place to do. And then just remember that whenever you are actually pricking yourself, that you actually put it up next to it, and just flush right with your skin so that the needle actually gets to it. And I did pull the plunger back, and I just wanted to let you know what it sounds like whenever you do actually click it. So you just hear click. You're not going to see anything, but you will feel it on your finger.
Got it.
So with the test strips, you can just throw right into the trash. With the lancets, it's a little bit different. You're going to want to use a new lancet every single time. So be very careful with taking this off, because the needle is indeed still in here. And then you're going to take that cap that I told you to remember to keep, and then you'll take it and put it right on top of it and push down, so that now that needle is not exposed anymore. There's no way you can puncture yourself anymore. And go ahead and take this out, and then you can place this directly into a puncture resistant container. We call them sharp skins, but basically this is anything that's puncture resistant that you're able to seal at the end of it. So once it's all filled up, you can go ahead and seal it, and by Colorado state law, you can just throw that right into the garbage. So then just put this back together for the next time you use it. And then so we want to use a new lancet every single time, just because the needle does get dull with every use, and it can cause more pain and just discomfort. So, and plus with it just trying to prevent infection and everything, just use a new needle every single time. And the same with the test strips. With these, they're very delicate, so make sure you're using a new one every time. Never put another drop of blood on top if you didn't get enough or anything like that. If you don't get enough, it's okay, just reuse a new one. And never use alcohol to clean it off or anything. Once it's used, it's done. All right, so I know I threw a lot at you. Could you just tell me how you're going to get your lancing device ready?
So I'm going to open the top part up, and then I'm going to grab one of the lancets, put it inside, twist the cap off, making sure that I don't bend the needle, and then I'm going to keep that just for safe disposal later. Then I'm going to put the cap back on and start with a dial at 1, just to make sure that it's not going too deep, and if I'm not getting enough blood, I can switch it to 2 or 3 or whichever one I need.
Perfect. And then I just wanted to remind you, or I actually wanted to go through other sites as well. So you can prick your fingers on the sides. That's what we recommend. But if it's getting too bothersome, too painful, or anything, and you want to try alternate sites, there are some, but that we can leave that for another conversation down the road. Just give us a call and we can talk about those as well. All right. So storage-wise, you're going to store your all of these that we talked about back in this little pouch, okay? And just keep this safe. It's really easy to travel with, so if you're going out of town, you can bring it with you. And just make sure it's in a dry area, just room temperature, no extreme temperatures, so not in the fridge or not on your car dash or anything like that. And what did your doctor tell you to expect with using this?
He didn't really say much, just that it would help with my diabetes.
Yeah. So like I said, these things are really awesome. They will store all of your readings. So when you go to your next doctor's appointment, take this in with them, and these readings would be really beneficial to them, and knowing where to take your drug regimen further and how to best optimize your therapy for your diabetes. Okay. And so when you are getting those early morning levels, your blood glucose levels, before you start eating, that's your fasting again, it needs to be between 80 and 130. That's the normal range. And then if you ever take your blood sugar after eating anything, it should just be less than 180. Okay. All right. And so I really want you to call your doctor if your blood glucose levels are reading below 70, and or if they're above 400. That's something that needs to have a conversation with your doctor to see what's going on and how we can fix it. And just go ahead and give us a call anytime if you get home and you forget anything, or if you are confused about anything that we talked about today. Just give us a call. Again, my name's Amanda. And what questions do you have for me?
I think I'm good for right now.
Okay. All right. Thank you so much, Ashley.
Thank you.